Welcome again to Odontogem. Today we have a very special guest, Dr. Sam Coe. Being passionate about mentoring and professional development from early on in his career, Sam co-founded the Young Dentist Hub back in 2015 and has since convened multiple CPD courses and events to allow new dentists the opportunity to improve and progress in their dental careers. Sam actively pursues clinical excellence and has attained a fellowship in orthodontics through the Progressive Orthodontic Seminars program and a fellowship with the International Academy of Dentofacial Aesthetics, as well as the Pierre Fauchard Academy in London. He is a speaker for KVOCUR and ClearCorrect, having lectured both here in Australia and overseas. As well as being a practice owner, Sam is an advisor for Polar Smile and the Miss Universe contestants and a Colgate oral health advocate. Most recently, he has teamed up with the likes of Dr. Anthony Mack and Dr. Andrew Chio to develop a year-long accelerated GP course called the ACE program. It aims to provide a comprehensive hands-on curriculum and mentorship to develop and accelerate the growth of younger clinicians in all aspects of general dentistry. With such a broad range of experiences, I'm really excited to have you on the show, Sam. Thanks for joining us.
Oh, thanks, Jesse. Appreciate you asking me to be on.
I'm really excited to get into conversation about all your endeavors and your journeying through dentistry. But for those who may not have come across you, do you want to give us a little bit of a background to how you got into dentistry and your journey from when you graduated to where you are today?
Oh, right. Okay. I graduated back in 2011 from Melbourne University. From there on, I kind of just took the plunge. I went up to the country. I worked rurally in northeast Victoria for about 3.5 years, actually, in a private practice up there.
Okay.
It was pretty cool because we were kind of traveling between different country towns every day. So I was basically the only dentist on, basically at that clinic in that town every day. And I did that for a good 3.5 years or so. And then after about 3.5 years, moved back down to Melbourne, found a job kind of out in a suburb called Taylors Lakes. And I kind of never left. I kind of loved it so much. I decided to buy the clinic over, and that's kind of where I am today, really.
Oh, perfect. And you mentioned you were by yourself out most of the time in the early days. Yeah. Did you find that particularly tough? I mean, because if you were the only one there, did you have anyone that you could call if you ran into trouble or anything?
Oh, mate, it was tough. It was like a really big sink or swim moment. Like when you're out in the country and you've got that kind of scenario, you either make it or break it, So I was pretty lucky that there are a few other associates kind of roughly around my area where I could kind of call them up and kind of go, hey, look, what should I have done in this situation? But it was always retrospective. Like it wasn't live. Like you couldn't really call someone up there and then and go, hey, I can't take this tooth out. What do I do? It was one of those, you kind of just get in there, try to do your best. And then afterwards, if you had any concerns or issues, then you'd call someone up or text someone and go, hey, look, how could I have done this better? Or what do I do next time? It was a really, really great learning experience. And I don't think I'd be the dentist or dental practitioner that I am without, going through that journey.
Yeah, definitely.
I think it's kind of made me the dentist I am. So I really do appreciate my time in the country. It's been a great experience.
Yeah, definitely. Well, it's really great to hear that you got through them, even though you were on your own a lot of the time. But now in your own private practice, what do you kind of tend to focus on in terms of your daily workflow? What's the kind of dentistry you like to do and as a practice focus on?
Yeah, look, great question. I mean, it's changed a lot. Back when I was working in the country, you had to see a lot of emergencies, right? Like I went through. I think you're a bit young for this, but I don't know if you know of the chronic disease scheme. Have you heard of that, Jesse?
Yes, I had heard of it.
So when I first graduated, that was the scheme that was still running at the time. So there was no child scheme or anything, and there was so much demand for dentistry back then. Like I think in my first year, there was a day where I literally did 9 to 5, but I saw something like 30 patients or something. It was pretty crazy. Right. And that was like with a normal 1 hour lunch as well. So you kind of learn to do first stage root canals and take teeth out really quickly. Otherwise, you're going to always run late.
Yeah.
And early on, that was like what I loved in my dentistry. Like I loved being able to get patients out of pain. I loved being able to diagnose things. And I loved being like the dentist that was different from what they were used to having. So, I know there's a massive generalization, but, up in the country, there's a lot of places where there's a lot of maybe older dentists or older style dentistry being performed. And a lot of the patients their only experience with the dentist is literally people holding them down and basically taking teeth out whilst they're still in pain, or taking the wrong teeth out, or things like that, like really simple kind of problem solving or treatment planning issues. And I loved being the dentist that literally got them over that fear and that anxiety. Kind of moving on, I don't want to say, now that I'm a little bit older and wiser, because I'm really not that old. But these days I really love two things still, really. Like, one is basically being able to do a really good root canal. Like, I don't know if you've seen like a lot of my Instagram stuff. Like, I always love showing root canal stuff, endo tips and tricks.
Absolutely.
So I love doing that. Like, when you find MB2, there's just like something that's so thrilling about that to me. And then the other thing I love is literally just all my cosmetic resin additions. So whether or not it's just like minor resin bonding or complete resin veneers, I just love being able to control what I'm doing with my own hands and actually like creating like a form of artwork, really. So they're really the two things I love these days.
Yeah, perfect. Yeah. It's, so, after you graduated from dental school, it was 2015 that you started the Young Dentist Hub.
Yeah.
How many years out was that from when you actually graduated?
That would have been like the fourth year out, actually.
Fourth year, okay. Yeah. And was that? Did you always know you were going to do that, or was it? Did you see a need that young dentists that had?
We like Viet and I, who's my co-founder. Yeah. We had no intention of forming anything as big as Young Dentist Hub ever got.
Yeah.
It was just one of those things where we were a bit disgruntled, to be honest. Like, without naming names, there were some associations and societies out there. There were no programs dedicated towards younger dentists, right?
Yeah.
So back then, and it's changed a lot even in 5 years, but back then, like, companies and organizations didn't really, like, I feel like they didn't value young dentists as in terms of, okay, this is where I'm going to get revenue to sell them this product, or this is, what I'm going to do to actually draw them in and come do this with me or something. And it kind of was shown when they were promoting courses. So these organizations, societies, they were selling courses to, let's say, bring down Michael Mandecost or Tony Rotondo. And, that's just for example, though. But they were charging an arm and a leg. They were literally just charging prices that young dentists like, yourself couldn't really afford to go to that much, right? And there was no program that literally just said, hey, this is like an introduction course, or this is a course that's tailored just to beginners and young dentists.
Yeah.
And we got pretty frustrated by that. So we said, you know what, like, we can do something ourselves for literally like a tenth of the price. Like, some of these courses are being sold for $2,000, right? For like a 1 day course.
Yeah.
And like, we're really proud of what we've done because we feel like we were almost the pioneers in Australia and New Zealand back in that time, because there were no young dentist courses then. And ever since we started, like, there's been all these young dentist courses popping up here or there, which are like a fraction of the cost that they used to be. And we're really happy with how, we've hopefully helped in achieving that sort of outcome. Because back then in 2015, if you wanted to do like a really nice course, you'd be paying over $1.5, $2,000 easy for whatever you did.
Yeah. Yeah, I can definitely say, even, going through the early years of dental school, the Young Dentist Hub was definitely, it seemed to be everywhere when I was looking around just at what courses were out there, and when I finished and graduated, and there didn't seem to be anything else at the time. So I definitely think you really started something special for younger dentists, and I think it's been really encouraging, especially as young graduates are kind of getting out there. We kind of have a place to look and have a place to go. That's a trusted source. It can be overwhelming though for students and new graduates when they graduate, because now there are quite a lot of courses out there. What would you kind of say to them, for people who are trying to work out what courses should I be focusing on, especially early on?
Yeah, this is something that I get asked on the social media a lot. My answer is focus on your bread and butter. Like, know which side your bread's buttered on, and literally get into the courses that are going to be 90% of all your procedures day in, day out. So what I mean by that is get really, really good at your restorations. Like, do some really, really good, solid posterior composite restoration courses. Do some anterior composite restoration courses. Learn how to do endo. Like, there's no point being able to do an amazing filling if you can't get a patient out of pain. Like, if they come in and they need a root canal, and you say, oh, look, I don't do root canals, I need to refer it off each and every time. Like, you're not going to build up your patient base that way. And if you don't build up your patient base, you're not going to get better. Like, you're not going to have the patient base there to actually work and learn on and get better on. So just really, really broadly, try to do composite courses, try to do some endo courses. And it's really, really hard to do this, but try to attend as many lectures or courses on surgical extractions and extractions as much as possible, because those main things are literally what you're going to be doing day in, day out. Like, don't stress too much about how to do, the aesthetic anterior crown, or don't stress about orthodontics in maybe your first year out, or don't stress about implants in your first year out. Just get the bread and butter done right, and then move on from there.
Yeah, okay. A lot of that sounds like, I know you were part of the helping out with the ACE program as well with Dr. Anthony Mack and Dr. Andrew Chio. And a lot of that program there focuses on a lot of those bread and butter things. Was that when you guys were, coming up with the vision for that, was that something that you really wanted to get through in the course?
Yeah, definitely. So, like, through the three of us, Andrew Chio quite well. And between the three of us, we've done quite a few courses over the years, right? Especially Andrew and Anthony. Yeah. And you kind of see the pitfalls. I don't want to say pitfalls, because university education is amazing, right? But there's only so much you can learn in 4 or 5 years of dental school.
Yeah, definitely.
So you come out, and I still remember the first few years out, and you probably remember your first year out, Jesse, where like you go, I don't know how to do this. Like, what's an onlay? Like, I never got taught an onlay properly. Or back in Melbourne university days, our prerequisite was to do one multi-rooted root canal to graduate, and that was our criteria.
Yeah.
And I came out, I was like, man, I don't even know how to find MB2. Like, we did a couple of lecture slides on it, and then that was basically it.
Yeah.
Same thing went for wisdom teeth. Like, we went into oral surgery and watched people take wisdom teeth out. Like, if you were lucky, you maybe took a few out throughout your dental school career.
Yeah.
So that was one of the things that we really thought of. We said, hey, how do we solve this problem? How do we solve the problem from being that final year dental student coming out and being, the first year graduate dentist that you are, and then literally accelerating and jumping towards that mark where you can say that you're a competent dentist in almost every single facet of dentistry. So the program that we came up with, and unfortunately it's sold out for the next year already, but it was basically centered on doing treatment planning really well, doing really great composites, doing really great posterior indirect restorations, doing really great molar endos, and doing your first implant restorations and oral surgery. So it was basically a collection of all the things that I found, and the other two found over the years, with young dentists continuously asking for help with. Yeah. And we literally just bundled it up into like a really comprehensive program. So you would hopefully by the end of it come out and just be a very well-rounded general practitioner.
Yeah, fantastic. So it really is covering all of those bread and butter elements that you were talking about before.
Exactly.
Yeah. So I mean, you've spent a lot of time, working in different areas, convening events and putting together courses. But when it comes down to lecturing as well, I know you've been a lecturer for ClearCorrect, and you've given seminars and webinars for Cavo Kerr. Were those opportunities that kind of just came that just came to you, or was that something you always wanted to do, get into actually teaching and lecturing as well?
Yeah, people ask me this all the time as well, to be honest. It's kind of, I don't want to use the word luck, but I'm one of those people that really believes in the fact that if you put your head down and do something well, people will recognize it over time, right? And I answered this question in a newsletter for something else, and I think the last line I wrote was, "You do you, boo." That's what I wrote, right? Yeah. And what I meant by that was basically people notice, like, dentistry is a very, very small profession. And hopefully, the young dentists that hopefully listen to this podcast will realize is you need to be nice to everyone. And this doesn't mean your fellow dental students and your dentists and your colleagues. It also means things like people like dental reps. So the people that come into your clinic and, their job is just to give you that Sensodyne, or their job is just to give you those Colgate samples. But just say hi, just say hello to them. And that's how the opportunities really came about for me. Like, I put my head down, just did my work. I never, you ask any of my close friends, so my really good mate Adrian Dang, Viet, you speak to them. I never wanted to be a speaker or a lecturer early on, right?
Okay.
It was just the fact that the opportunities came to me.
Yeah.
And the second part of my answer is, I joke about this quite a bit, but I live my life pretty much according to, you know, that Jim Carrey movie, what's it called? Yes Man.
Oh yeah. Yeah.
Yeah. So I don't do exactly what he does. Like I don't say yes to everything, but I basically always say a maybe or like a maybe yes to everything. So the first opportunity that came about to me was through ClearCorrect. So I think it was mainly because I had done a lot of ortho and a lot of ClearCorrect course cases. And when the rep came around, I always made time for her. I always said hi. Like I wasn't rude, basically. Like I wasn't out of my way. Here's some chocolates. Here's lunch and whatever.
Okay.
But you know, we talked. We were on civil terms, and the opportunity came to me and said, "Hey, look, we're really looking for someone that's done as many cases as you that can do some courses for us. Are you interested?"
Yeah. Cool.
I think my answer to them at the time was, are you sure you want me? I never think people want to listen to me, right? Like even with this podcast, I hope you get people listening, but I still feel like, if we get 10 people listening, I'm pretty happy.
No, I'm sure we'll get a few. I'm sure we'll get a few listening to you.
But yeah, that's how it came about. You stay humble. You basically just do your thing, and then just be nice to everyone. And when the opportunities come, and they will come if you really do the hard work, right? Like you don't expect a free ride. Like don't expect things to come to you. Like you just do your work, and then when opportunities arise, then you kind of then consider it and go, you know what? Maybe I can do it. Maybe I can't do it. And that's kind of how all the roles came about. I basically always said to them, look, I don't know if this is for me, but I'll consider it. And then one of the things I've learned now is always sleep on something. Okay. So never make a decision like literally, straight away. I'll always sleep on something, and then the next day kind of make a good decision from there.
Yeah. Okay. That's cool. That's pretty very, very useful advice. What was your first lecture like, delivering it for ClearCorrect? Do you still remember it?
Do you really want to know? Yeah, I remember every single second of that lecture. It was It was
no, definitely keen to hear.
It was me with my hands in my pocket with the finger clicker, literally like constantly pressing on the finger clicker to try to calm my nerves a little bit. And I was really stressed because when you go to like lectures and conferences, and there's always like people at the front, it's always people at the front, and they ask the most complex and most random questions. And I was pretty scared because when I entered that room, I knew maybe a few of the people that were in that room, and some of them had done some ortho courses like POS and EODO, and they had done Invisalign, and I knew that they were experienced. And I was shitting bricks, and I hope I can say that. I was just shitting bricks, and I was just like, oh my goodness, I don't know if I know enough to answer their questions. And kind of got through it pretty well. Like I was pretty lucky that the ClearCorrect rep was in the room at the time. Yeah. And every time I kind of felt like I was getting a bit bamboozled, I'd be like, oh, hey, by the way, what do you think about that, Riley? What are your thoughts?
Yeah.
And,
nice.
Yeah, so just try to bounce it off her a little bit.
Yeah.
But yeah, it went really well. Apparently the feedback was really good.
Excellent.
And, haven't really looked back.
Yeah, and I guess once you had the first one under your belt, it was always a little bit easier each subsequent time.
It is and it isn't. ClearCorrect likes to kind of update the presentations pretty regularly because technology keeps changing.
Yep.
And then you never know who you get in the room. I had a dentist that was in the room that every time I said something, she would put a hand up and talk about the alternative philosophy through things like MyoBrace and things like that.
Okay.
And it's just hard because sometimes I feel like they come in and they're set on asking you particular questions regardless of what you teach and what you say. And it can be quite tricky. Like it depends who's in the room on the day. So I never take it for granted when I walk into that room. If I'm lecturing or if I'm talking to anyone, I'm always ready to answer the most random questions out there.
Yeah. Okay. Oh, that's good. Well, I'm sure you'll be lecturing for some time, hopefully in person once we get out of this pandemic period. Yeah. What about your work for? I know you've written articles for Colgate, and you're an oral health advocate for Colgate. Again, is this really one of those opportunities that came up just through you talking with people, talking with reps and others that in the dental field?
Yeah, look, it's again half-half.
Okay.
So I didn't really realize this either, but I got approached from Colgate to be one of the founding members of that committee.
Okay.
And I later found out that it was actually a rep that I used to talk to from Listerine, and then she had moved over to Colgate, and then she had put my name forward because every time we were running Young Dentist Hub events, we were always trying to get Listerine involved. Like we were basically saying, hey, look, does Listerine want to do something?
Yeah.
And I must have left a really good impression on her, perhaps, or maybe she'd already thrown my name in the ring when they were considering forming the committee. So that's kind of how it came about. It was basically just, again, doing my own thing, doing it humbly, doing it really, I guess, politely, in terms of just treating reps like human beings, right? Like you hear about a lot of dentists not treating reps very well.
Yeah.
And then at the time too, like I'd done like a lot of weird Colgate art sort of stuff. So if you've seen like photos of my surgery, I've actually got like a weird painting on my clinic wall, which is, it looks like a tooth, and it looks like I've drawn it out of Colgate toothpaste.
Oh, okay, right.
Yeah, so I've kind of, I've done a few of those Colgate artworks over the years, and I've sent stuff through to Colgate to show them and say, hey, look, this is what I've done, or I've tagged them in my Instagram and said, hey, look, this is a cool thing I've done. And apparently they've seen that as well. So I think that in combination with my connection with this Listerine rep has kind of got me within that committee.
Yeah, oh, great. And what about your as an advisor to PoleSmile and the Miss Universe contestants? I mean, like what does an advisor for the Miss Universe contestants do?
It's a good gig. Yeah. I mean, I'm very, very fortunate. I did a lot of work with SDI early in my career.
Yeah.
And they're a great Australian company to work with. Like if you guys have ever had a chance to speak to one of the reps or deal with SDI directly, they're just really, really nice. Like they're literally just really near you, Jesse. So they're in Bayswater.
Okay.
And the opportunity really just came about through doing a lot of work with them. I'd done a lot of video webinars and tutorials and things like that with SDI. And of course at the clinic, we use a lot of Polar.
Yeah.
And I guess what the role really entails is just being an ambassador for Polar. And thankfully enough, when the opportunity comes around every year with Miss Universe, we get to see some of the contestants at the clinic.
Oh, yeah, yeah. Cool.
So we basically make them some whitening trays as part of their Miss Universe journey.
Yeah.
We then present it to them at Polar parties, and we get to interact with them at these statewide finals.
Yeah.
And then, unfortunately, this year we should, hopefully still have a national final in some way or form, and we usually get to be invited to that and mingle with them there. But I'm not sure what's happening this year. But it's a pretty good gig. You get to mingle with a lot of, social media people. You get to meet a lot of people in the industry in terms of like Miss Universe contestants, previous contestants, which were now hosts. Like if you know Francesca Hum, she was Miss Universe for 2018, I think.
Okay.
She's now basically the host of E! News, right, in Australia.
Right. There you go.
So you get to meet a lot of interesting personalities. I actually became really good friends last year with the person that was the singer at the national finals.
Oh, yeah. Yeah.
So Nathan Foley, who was an ex-High Five member, like a founding member.
Oh, yeah.
We got on like a house on fire at the after party.
Yeah.
So yeah, like I met him. I went to his 40th literally earlier this year, I think, in Sydney.
Okay.
So yeah, you meet and mingle with a lot of people at those sorts of events. So I've been very, very lucky with PoleSmile. They're a great company to work with.
Yeah, it sounds like quite an adventure you've had so far.
Yeah, definitely. I mean, the day that you say a Miss Universe contestants walk through your doors, it's not a bad day,
Yeah. Yeah. I mean, well, speaking of social media as well, like you're very active on social media. Not only sharing about different companies that you're working with, but I think especially things that I've benefited from the tips and tricks that you share, whether it be on your stories or in the posts that you make. How different do you think dentistry is now that younger dentists and dental students now have access to dental education almost through social media as well?
Yeah, it's really good, but it's scary, like it's good in a way where you can see what other people are doing in the world. Like you don't even have to limit it to Melbourne or Australia or whatever. You can basically see, hey, this is what this guy's doing in Brazil or Argentina or, Style Italiana in Italy or whatever.
Yeah.
And you can really set benchmarks for yourself, and it kind of helps you kind of be goal orientated and kind of work to be a better clinician and say, hey, look, I really want my work to look like this guy. It can allow you to basically learn a lot too. Like, if you click on my stories once in a while, I've usually got like a tip at least once a week about extractions or root canals or something. And it might open your eyes and go, hey, this is something little that I never thought, I could have done and now I can do it. But it's scary too, like I feel like there's a lot of anxiety when you're a young dentist and you click on social media, because those very same things that I said are really, really good to look at.
Yeah.
They can scare the heck out of you too. Like you start feeling like really incompetent, like, you're not good enough, and you start comparing yourself a lot. I know early in my career, I would jump on Instagram and be like, hey man, this guy's literally the same year level as me and he's doing this. I haven't done this yet. So like, I must be really incompetent. Yep. Or this guy does, this with his resin composites and I don't do that. And look, it's good and bad in a sense. You can learn a lot and you can basically compare yourself and set benchmarks, but you also don't want that to really give you a lot of fear in terms of what you haven't achieved and, goodness, FOMO, I can't do this or haven't done this yet. If that makes any sense.
Yeah, no, it does. So do you think one of the major pitfalls is that comparison trap that younger dentists can kind of fall into?
Yeah, look, there are a couple of things where I feel younger dentists need to be very cautious of with social media. First of all, once you put something on socials or online, it's out there, right? Mm-hmm. Like anyone can see it. And you need to develop a really thick skin early on. Otherwise, don't do it at all, right? Yeah. Because there's always going to be that social media troll. Like we both are probably a part of, a group on Facebook where people always get out some popcorn or people will always, troll a little bit here or there.
Yeah.
And it on social media, sometimes people do it behind your back, or even worse, people do it right in front of your face, right?
Yeah.
And you need to develop a really thick skin very early on.
Yeah.
Otherwise, you might go down that rabbit hole where you just think you're not good enough.
Yeah.
So that's one of the major pitfalls that I really, really would stress to consider before you start a social media profile.
Yeah.
And part of that too is you got to stay humble. Like one of the key things that I kind of keep talking about is if you don't act humble or stay humble, and you don't, if the moment that you think that you're the best of anything is the moment that you know nothing. All right. I say this quite a bit, and I see a lot of dentists out there that are really trying to get their social media profiles up there, and they're literally like maybe 1 or 2 years out or 3 years out.
Yeah.
And they sometimes kind of like might rub off the wrong way on some clinicians, and they don't they act like they're very well versed or at the top of their game and know 100% of what's going on. And my advice to them would just be kind of make sure that you're whatever you're doing, do it well, but just remain humble and acknowledge that everyone's still learning. Otherwise, you're going to get a lot of people, kind of after you very, very quickly.
Yeah. Okay. Well, I guess what I like about your posts as well, and I know, like, it's easy for a new graduate to look at the work you do and be like, oh, I fall into that comparison trap with being like, oh, I don't find it's so much harder to find MB2 than how quickly Sam finds it and things like that. But the one thing that I like about what you do in your posts is you actually interact with people who actually ask you questions, and I find that you often respond as well. So that kind of helps break it down a bit and doesn't, obviously it's still difficult to get to that kind of a level, but at least it gives you those little steps that you could take to eventually kind of get there. Have you always engaged with people on social media like that?
Yeah, I mean, I have. Like, I mean, I don't like, so my lecturing style is just exactly like how I'm conversing with you right now, right? Like, I like talking to people. I don't like talking at people.
Yeah.
And I find that really resonates really well with people listening. Like, they really like the fact that you're not talking down to them, you're talking with them. And that goes for interaction too. Like, the way that I hopefully try to come across on my stories or my posts is to help educate people out there, but also kind of do it in a manner where you know what, if you want me to help you out or give you a bit of advice along the way, just shoot me a message as well. So these days, I get a lot of private messages after I post something, and I'll respond privately to those messages when I can. And it basically just, it helps both ways, like sometimes they shoot me through a message that I haven't even considered before. Okay, oh, look, that's something really interesting, like I'm really lucky now in the position that I'm in. I've got some very high-powered friends, like when I post something up on Endo, I'll get, someone like Omar Ikram replying to me, or someone else, like Ian Myers might respond to a GIC post of mine, or Anthony Mack responds to like a anterior, indirect question of mine, and they'll give me some advice or pointers which I never even considered. And you'll see I'll reshare them. Like I had Dr. Tiverman send me through a post reply the other day, and I literally just shoot it up on my Instagram stories, because all of this helps everyone. Like, the more collegiate and the more collaborative you can be with your colleagues, the better. Like, there's no point attacking people. There's no point saying, oh, this guy's doing really shit work, or this guy's not doing the right thing. Like, it's better if we all get better together. So why not?
Yeah, definitely. And do you find another positive of having your dentistry on social media is you have been able to meet people that you wouldn't have met previously? Is that quite common?
Yeah, a little bit. I mean, most of the people that I know through my networks through face-to-face. Like I'll meet them at events or courses or meetings. I guess I have had a couple of like mini intros on social media, perhaps at times with some people, but no, not really. Like I know a lot of other dentists do interact a lot with others on social media, and that's how they meet people. But I guess because my interaction started pretty early on in my career, it was kind of pre-Instagram, especially. And then Instagram came about, and that's allowed me a way to kind of keep in contact with them, but it wasn't a way for me to really meet them initially.
Yeah, definitely. I mean, I guess you've also got so many other things going on. You can't be on social media all the time.
Oh, look, my associates will argue otherwise. They'll expect a response from me literally within the first 30 seconds.
Well, I mean, like given everything else you do as well, how do you, like you've got two private practices at the moment. How do you find time amongst Young Dentist Hub, social media, private practices and lecturing to cram everything, or do you sleep or?
Probably not well. Like you can see the bags underneath my eyes. I'm one of those people that if I'm not doing something all the time, I feel like I'm being lazy, I don't know, do you feel that way as well, Jesse? Like, are you that sort of person, or?
Yeah, I guess I always like to be active, or especially now in like with all this downtime in COVID, I find it hard to just sit and do nothing, so it's either taking up some extra CPD or things like that, because so maybe a little bit similar.
I mean, you started Odontogen, so that's amazing work to do during lockdown period, but that's kind of like I mean that's exactly what's happened here as well, like if I'm not doing something, I feel like I'm going backwards. So you'll see me like, even during this chat, people are shooting me through messages, and I'm literally, having a look and kind of thinking about what I need to do there. I'll be on the call, during clinic hours too. Like my phone's on loudspeaker when I'm treating patients. And so if someone's calling me from my other clinic, I'll basically get my nurse to pick that call up, and I'll kind of try to answer it, through seeing patients. But to answer your question, I have no idea, man.
Just go along with it.
Just do it. And like I'm one of those people too, where if I got a task, if it's on my list, I won't be happy till I get it done. I've always got, like, I'm old school. I've got like a manual diary. I don't have things on my phone, and I've got like a to-do list on my diary that I cross off.
Yeah. Oh, that's cool.
And that's how I get through things.
Oh, awesome. You mentioned the workplace being pretty busy, answering calls here and that. A lot of the time, are you discussing cases with your associates as well, or are they calling you up saying, I'm struggling with this exo or this endo or something?
Yeah, I mean, I can't be there all the time. So I've taught them ways to kind of try and manage the situation when I'm not there. So they'll sometimes shoot me through a quick x-ray and be like, hey, I don't know what to do here. How do I take this tooth out? Or I'm stuck, like I got this file stuck, or how do I get it out? And other times it's about, we were talking about this kind of off air before, but me and a business partner literally just recently bought another clinic, but we also bought the attaching shopping arcade. I don't know what we're thinking. So we bought like a row of 8 shops,
Yeah.
and we're currently converting it from a 1-chair clinic to basically a whole medical and dental center. So
Right. Okay.
the stress has been
Yeah.
pretty bad lately. Like the chairs are going in this Friday.
Yeah.
So I've got literally like all the stuff literally on the go right now. So I'm getting a lot of phone calls at the moment about, oh, look, this laptop's not working, or this equipment's not working, or the builder wants this done, or the builder can't find this.
Yeah.
So it's been a bit of a headache at the moment.
Yeah, well, hopefully you get through it in time for when restrictions and all that start to ease.
Yeah, exactly.
For your associates as well, are you encouraging them to do as much CPD as you yourself do as well? Is that kind of part of the culture of your workplace?
Yeah, 100%. I mean, I really want my associates to really be 100% like the all-round general dentists that hopefully I'm trying to aspire to be.
Yeah.
I want them to be able to think on their own 2 feet, and I always encourage them to do as many courses as possible, within reason. Like you got to pick and choose your courses wisely.
Yeah, of course.
And there's a lot of courses out there, like we discussed earlier, and you've got to choose the right one. So choose trustworthy courses from reputable providers.
Yeah.
Choose courses that are run by really well-known speakers that you've seen their work of or heard of, or better yet, like if you have a dentist that you're aspiring to be like, or a mentor, so let's say I was your boss, right? And you said, oh, look, Sam, how do I do my composites like you? Or how do I do my root canals like you? Where did you learn?
Yeah.
And if they recommend a course, then that would be high up on my list of things that I want to do.
Okay. Yeah.
So I always encourage my associates to do a lot of courses, but I will always point them in the right direction, because I've done a few bad ones along the way, and I've done lots of good ones along the way.
Yeah.
I've got to point them along,
Yeah, definitely. And because you do mentor a lot of associates in your own practice as well, for those that have come pretty much straight out of dental school, what's a common theme, if there is a common theme, that you're finding that they tend to be lacking in? And that's of no necessary fault of their own. We're kind of new to the game, but is it more the clinical side, a specific area that they're lacking, or is it more like a non-clinical aspect?
Oh, there's a few things. Again, without sounding terrible, like you can only learn so much in 4 or 5 years of university, right?
Yeah.
But when you hit the real world, I mean, you only know one way. I think this is the way that I think about it. You only know one way of doing things. And I feel like when clinicians get out, it's one of those things where you don't have your mind open to how things are done in the real world or the private setting.
Yeah.
And that can kind of come across the wrong way to a lot of practice owners out there. They think, oh, this clinician is stubborn, or this clinician is needy. They need this certain equipment to do this sort of work. And so I think that the general overarching thing that I feel a lot of young dentists have when they come out is the inability to adapt to any situation.
Yeah.
So that's both clinical and non-clinical.
Yeah.
And what I mean by that, Jesse, is like, let's say you're doing a composite and it's not a straightforward DO, and there's like a massive palatal fracture. And for the life of you can't get a tophomite on there, you can't get a sectional on there, nothing's grabbing. What do you do, right? And a lot of dentists come out and they don't have that street smarts yet, where they can go, oh, look, I have tool A to do this, or if tool A doesn't work, I'm going to go to trick number 3, or plan Z. And I think that's a thing that they really kind of lack when they first come out, and that's through no fault of their own. Like you said, it's just due to kind of maybe lack of experience, or lack of real world setting and experience. The other thing too that you kind of alluded to is communication. Yeah. So I'll lecture a little bit about communication with companies like Straumann and with MIPS.
Yep.
And again, that's through no fault of anyone's. It's just something that's not taught much in university, business and communication. Definitely. And that's like literally 99% of what you need to know as a dentist. Like you can be the world's best dentist at doing a filling, but if you can't communicate that across to the patient and make them happy, there's no point,
Yeah.
So
definitely.
They're the main things I think are lacking.
Yeah, I can remember going through dental school, and probably in years 1 and years 3 out of the 5, I think we got maybe 3 or 4 lectures on it. But again, it was just lectures where you're just sitting and listening. You're not actually learning how to communicate properly, or improve that. So it can definitely resonates as well, having just gone through. Look, Sam, I don't want to take up too much more of your time, but just to finish up, Obviously with COVID, it's thrown a massive curveball at all industries and especially the dental industry. And it's also really affected dental schools and dental students. For those that are now in the position where they're starting to think about jobs for next year, as someone who hires, new graduates and someone who mentors younger dentists, what advice would you give to those applicants, who want to set themselves apart from the others? What should they really be trying to bring to the table to their job interviews and also to new working life next year?
Yeah. I think it's pretty much the same answer I'd give even if COVID wasn't around, but obviously at the moment it's a bit more competitive.
Yeah.
You got to think of a way to stand out, like you said, and the way to stand out at the moment to almost every single practice owner out there is showing passion and commitment, right? And it's the case of everyone graduates with the same dental experience, right? There's no point these days even putting stuff on your resume about what procedures you've done in dental school because everyone knows what you learn in dental school, right?
Yeah.
But what is going to set you apart is the fact that you have done something extracurricular or extra dental, which is showing me that you are productive with your time or doing something creative. So something like what you're doing with this amazing podcast, Jesse, Odonto Jam, So if you had done that in dental school and you could put that on your resume, that would stand out to me. That would show me that when there's downtime, you have got that passion and basically willingness to do something extra rather than sit around playing Xbox, PlayStation, just doing nothing, lazing around, reading a book or whatever. You've got that commitment to actually try to further and progress yourself in the dental field. Similarly as well, not just that, if you basically showed commitment to come to me and say, hey, look, I know you're not hiring at the moment, but I'd love to come and observe you and literally just get your foot in the door that way.
Yeah.
At least know, have your name known through a couple of different dental clinics. Yeah. So I've had a lot of dental students over the years come and watch me. I don't really do it anymore just because I do get requested quite a bit.
Yeah.
But they come through and I know their name, right? And they don't just come through the one time. They come through literally multiple times.
Yeah.
And after that, I build a really good rapport with them. If I don't have a job, the next time that, my friend Adrian or Viet or whatever has a job opening or something available, I'll go, hey, look, that person, Jesse, came through, he watched me a couple of times. He was really inquisitive. He asked the right questions. He seemed to know his stuff. He was quite professional. That's already like a mini job interview without you even asking for one. You've literally got your foot in the door and literally had a job interview a couple of times at a dental clinic. Yeah, right? Definitely. So if you can do something like that and literally poke your head in, be nice to the staff. So again, coming back to my very first point, be humble and nice.
Yeah.
If you can be nice to the receptionist, you got to remember the receptionist and practice manager is literally the person that usually says yes or no to the applicant, finally. Because once I basically get a short list of candidates for a position, I'll then literally throw it to my team. I'll go, Taylor, Ashley, Anita, what did you think about this dentist? Did they give you a really good first impression?
Okay.
And if they say yes, then, winner. So two things, try to think outside the box during this downtime with COVID. Yeah, okay, you know what? You might not find a job for 6 to 12 months, but what are you going to do in that 6 to 12 months? Go volunteering somewhere, volunteer at a shelter or I know it's hard, but overseas or rural or do something with the Flying Doctors Service.
Yeah.
Start a podcast, start a blog. Do something that is out of the box. Don't just do the norm. Think outside the square now. Think outside and think, this is what is going to show my passion for dentistry and my commitment to continued learning and my commitment to customer service or patient experience. So be nice to everyone and try to learn and do as much as you can during downtime.
Yeah, no, fantastic. Yeah, definitely great tips, especially for those either looking for work now and those who will be looking for work next year. Look, Sam, thank you so much for all your advice and all your tips here. And please keep sharing on social media. If you're not following Sam yet, find him on Instagram at Dr. Sam Co. Also, be sure to check out the Young Dentist Hub Facebook group. There's lots of cases and good tips get posted up there as well. Thanks again, Sam, for coming on. It's been a really great chat.
My pleasure, Jesse. Thanks for having me on. And just to elaborate on that too, we're doing a lot more clinical cases and posts on the new group Dental X.
Yep.
So if you wanted to see some more clinical cases, there's some amazing things and tips and cases posted up there. But thanks again, Jesse. And really appreciate having the chat with you today.
All right. Thanks so much, Sam.